Hello and welcome to the Healthcare Huddle video podcast. I'm your host, Rachel Slawson, and we will be following on from our last episode. And today we'll be talking about considering infection prevention control, personal protective equipment, and infrastructure whilst undertaking an investigation in a health or social care setting. We will be talking with Leslie Underwood, registered nurse and public health professional. Leslie wrote the original article titled Investigating Transmission of COVID-19 Within Health and Social Care Settings. You can find this article at the Fascia Melius website, which is fascia-melius.org.uk. I'll leave all the links in the description below. Fascia Melius are sponsoring this series of podcasts that we are creating. They are aimed at healthcare professionals within health and social care, and Fascia Melius are a healthcare consultancy which offers a unique combination of insight, innovation, and experience. They specialise in quality, governance, and patient safety investigations. Welcome, Leslie. How are you?
Fine, thank you. Lovely to be here again.
So, Leslie, for those who didn't watch the last episode, I will leave a link, by the way, in the description below if you want to go and listen to the last episode. Do you want to give a little bit of a background about how this series of podcasts came about?
I actually have a background, as you said, in nursing, but I also have a background in governance and investigations. I'm listening to news and reading articles in the press. I get really cross about how people judge what we've done. So I thought it was about time we took control. So I wrote this article based on some of my experiences of investigations, but to give people an idea of some of the things they could look for if they wanted to do a look back exercise of their experience of COVID-19 to see what they could learn and perhaps what they could share with the people.
So, if people were thinking about undertaking an investigation, but the cases of viral spread were not reported as a serious incident, why would you treat them as such?
It's not necessarily treating them as such. It's a case of looking back at what we did to see what we can learn. So if they found that there had been some viral spread, chances are something happened that shouldn't have done. Now that's not to say anybody's to blame. That's just to say we need to look at it and find out what we can do differently. So if we were to hit with wave 2, or heaven forbid wave 3, or we had an influx again come winter with our seasonal flu, that we actually had the skills, the equipment, everything we needed to be able to cope effectively and efficiently with this second bout of the virus.
So, who would you suggest undertakes a review like this?
Under normal conditions, so if you were talking about one of our normal viruses or bacteria that are, out in the general public all the time, it would be our infection control professionals. However, other investigations are undertaken by other people, and as long as people have had training, anybody can undertake it. So the person would need to have some elements of root cause analysis training to be able to do it systematically. But that said, it could be somebody from governance, or it could be somebody from the quality team. It could be another nurse or another professional, or indeed you could look outside the organisation and get somebody else to come in and do it.
And how long does a review like that take?
Well, when we talked last time, we were talking about whether we did it as a look-back exercise or whether we did it as a full-blown serious incident review. If it's a look-back exercise, or if it's recording a debrief session to gain people's ideas of what went well and what didn't, that you could do in an hour, 2 at maximum. However, if you were doing a full-blown review, it can take up to 30 days and sometimes longer, depending on how many people are involved, how many agencies are involved, and how quickly people get back to you with information that you require to complete the investigation.
Yeah. And in these series of podcasts, we're covering some of the different aspects that you could consider during an investigation, as part of the whole. So the first episode is really important because it gives the overview, and then these episodes will break down some of the specific areas that are very specific to COVID-19. So is there anything that staff should consider whilst undertaking a review in relation to PPE, infection prevention control, and the infrastructure?
I believe we have mentioned previously, certainly in the last podcast, the fact that I've written a checklist to help people, guide them through the certain things they should be looking at and considering. So if we were to look at equipment per se and PPE, you would think you would want to consider things like, were there sufficient supplies? Were they there at the right times for you? Or were you always trying to fight the fire to get that there? Now, we know there was a huge issue over PPE across the whole of the country and nationally and internationally. So we know that's going to be an issue. But what we want to do in your look back or in your review is how are we going to stop that from happening next time? So what sort of reserves do we need to have? Those sorts of things you would be wanting to look at. Things like, were specialist equipment available to the teams? So, for an example, if you had speech and language therapists who undertook speech and language assessments or swallowing assessments where somebody might be coughing, did they have the specialist equipment they needed? Because they weren't considered a frontline nurse, so they may not have actually had access to that equipment. So it's things like that you need to put into perspective of the area you're looking at, the people who'll be using it, and actually do they have the right equipment there at the right time. So other things, if you're looking at equipment, not just PPE, but did people have the right cleaning equipment? Now, if you're looking at social care, where some people don't have access to the big NHS supplies and the big NHS providers, some people had to go down the local shops to try and find bleach. We need to make sure that doesn't happen next time. So it is, again, looking at how that occurs. So in terms of PPE, we know there's a huge issue. What we need to do is review what happened, how it happened, and how we're going to prevent those shortages happening next time.
What is the basic level of training people should have had particularly around infection prevention control? What would that include?
Okay, well, you would expect that everybody would have a knowledge based around the standard principles. Used to also be called universal precautions. So that involves things like basic hand hygiene, basic use of personal protective equipment. So that would likely be gloves and apron. How to dispose of waste, how to clean up spills, the very, very basics, how to care for laundry, that sort of stuff. Now, that level of training is usually given to somebody when they first enter a trust or an organisation, or when they first start in a role. And how often they have to renew that depends upon their job, which is why I said it really does depend on where people are working and what their job is.
What is the basic level of training people should have had particularly around infection prevention control? What would that include?
Okay, well, you would expect that everybody would have a knowledge based around the standard principles. Used to also be called universal precautions. So that involves things like basic hand hygiene, basic use of personal protective equipment. So that would likely be gloves and apron. How to dispose of waste, how to clean up spills, the very, very basics, how to care for laundry, that sort of stuff. Now, that level of training is usually given to somebody when they first enter a trust or an organisation, or when they first start in a role. And how often they have to renew that depends upon their job, which is why I said it really does depend on where people are working and what their job is.
Is there any other aspects that you think that they might need to cover in terms of PPE? Like, a lot of hospitals are built in a certain way and, might have been built a while ago.
Yep.
And suddenly you're introducing a whole new way of working.
Indeed. Something else I've added to the checklist, I put it under a different title, funnily enough. But anyway, I've talked about the environment. So we know we have different environments. So if you're trying to isolate somebody who has COVID, you would expect them to be in a single room, because actually you need to isolate them from others. But a lot of our buildings aren't built that way. Some still have 4 6-bedded bays. Some of the old Nightingale, and I don't mean the new Nightingale hospitals, the old Nightingale wards. So where you actually had the ward and you got the beds around the edges. Depending on what you've got, you need to work out how to manage that situation. So the actual design of the building itself doesn't always lend itself to what you need to do. And in a pandemic like this, you have to adapt. So with hindsight, did we do the right thing at the right time? Did we use the right places first? So did we use the right hospital wards first before we move people on? we would like to think there were suitable areas for putting on and taking off PPE, so donning and doffing your PPE. That ideally should be done separately to the actual clinical area, but a lot of places don't have that. And then if you look at other areas, so you look at mental health, for example, you can't even leave a trolley outside a single room because somebody may take it away. If somebody has dementia, what's that doing there? I'll take it away. You ask people not to do things, but they don't remember what you've asked them. So again, there are different scenarios where different things need to be looked at. And I think in taking the area as a whole and what function that area has and what sort of people are looked after actually gives you an idea of some of the things you could look at. But going back to mental health, you can't even leave PPE out because it can cause a risk to some of the other service users. So people have had to be very systematic in how they do things and learn different ways of managing and different ways of using PPE. So where we would have our normal routes in general hospitals, in other settings that may not be possible. So all those things need to be considered when you're actually looking at what did we do well? Well, actually, if all the patients are safe, you did very, very well, and you should have a pat on the back for that. It's brilliant. It can be very, very difficult.
Yeah, it's definitely been a challenging time for all staff, and a lot of people have had to adapt to completely new ways of working, new environments, new equipment, all at the same time, along with, a brand new disease that none of us had ever seen before. And so there's
Exactly.
so much uncertainty, and then throw in a whole load of extra stuff that you don't normally do as part of your everyday job. So, yeah, I would imagine there's quite a lot to learn from that.
Well, exactly. And also you had the issue with the fact that the advice was changing all the time. So as soon as we learned something else, new advice was put out for people to take on board. But actually, you then had to adapt to do something differently yet again. So you're in this sort of constantly changing world and environment, and having to keep up can be really time consuming. So again, how do we keep on top of all this new information and the new ways of working? Did we have somebody there to help us guide us through that? How did that work?
Yes, and we will actually be covering that in our next episode, which will cover training and communication. So
Brilliant.
that was a nice segue there, Leslie. Thank you so much, Leslie. That was a really, really helpful discussion, and hopefully people got a lot out of that. I know that I did. If you want to read the full article, you need to visit facere-melius.org.uk. That is FACERE-Melius, MELIUS.org.uk. I'll leave the link in the description, and I need to thank our sponsor today, who is Facere-Melius, healthcare consultancy firm. You can follow them on LinkedIn and Twitter, and as Leslie mentioned earlier, we have created a downloadable root cause analysis checklist. So we will leave the link in the description, and you can go over and check that out and download it and use it in your investigations. Hopefully it will be really useful. As I said, we have created a series of 4 podcasts to be released Tuesdays and Thursdays for the next 2 weeks. And the 5th podcast will be a question and answer. So head over to Twitter and LinkedIn to submit any questions that you have that you would want to ask us to answer on governance in healthcare and COVID-19. If you're joining on YouTube, please like and subscribe so you can be notified of the next video. And the next episode, as we mentioned before, is focused on training and communication. So thank you so much for listening to the Healthcare Huddle podcast. Please like and subscribe and stay safe, and we will see you next time. Bye.